The High Desert Heart Institute was founded by Dr. Siva Arunasalam, who is an affiliate of Cedars-Sinai Hospital in Los Angeles and is internationally respected for his superior care of high-risk heart patients. In July of 2009, the Heart Institute concluded the most comprehensive human clinical study ever conducted on a nutritional supplement. They selected 33 of their high-risk congestive heart failure patients for this 90-day study. Many of these patients were on the heart transplant list, and all patients had reached the end of what medical science could do for them. After taking the nutritional supplement ProArgi for 90 days, many of the 33 patients in the study were able to recover their normal lives and were no longer candidates for heart transplants. They were able to either eliminate or greatly reduce the drugs they were taking. Each patient was given 2 scoops of ProArgi in the morning and 2 scoops in the evening. Each week, every patient received extensive diagnostic testing, producing almost 7,000 points of data to scientifically measure the effects of ProArgi. Until a research paper for the study is published, we can't reveal the results here, but you should ask your ProArgi representative for the details. As part of our tour of the High Desert Heart Institute, we have an interview with Dr. Siva Arunasalam and a special interview with Angelo Sisi, who is one of the patients who participated in the study.
Here we are today in Victorville, California, and we're delighted to have our guest as Dr. Siva Arunasalam, who is the director, founder of the High Desert Heart Institute in Victorville, California. And Dr. Siva, we're so delighted to meet with you today. Would you just share with our audience your credentials as a cardiologist and your background and educational pedigree?
I came to this country in 77 actually. I went to undergraduate in University of Nebraska. And then I did my MD PhD, started in Johns Hopkins, and then I transferred to Emory University in Atlanta, where I did my MD PhD program, and then I did my residency training and my fellowship at UCLA and Cedars-Sinai Medical Center.
Cedars-Sinai, that's obviously extremely distinguished.
Yes, it is.
And based upon that, so board-certified cardiologist as well as internist, is that accurate?
That's correct. I have board certification in internal medicine, cardiology, and interventional cardiology as well. And within the last 10 years, we have grown to 5 cardiologists in a 20,000 square foot facility. And what we have found is the chronicity of illness is getting worse. We are seeing less and less people with heart attacks, but we are seeing more and more people with chronic illness of congestive heart failure, patients who are having continuous symptoms of chest pain, because we are saving those patients who used to have heart attacks. We're able to intervene and save them. But now we are ending up with problems where the heart muscle is weakened because of the damage that has been done. 20 years ago, those patients would not have lived, but with modern medication, we are able to keep them alive. And now we are reaching the next stage. The stage is we've already maximized the medical management. So what do we do next for our patients? Patients are in their 80s, their brain is still functioning, they want to be active, but they are limited by their cardiac condition or their medical condition. And so we were looking for alternatives. But now we can give this nutritional supplement in very high quantities and high frequency that will mimic nitroglycerin without all the side effects. And
it seems from my experience in the last couple of years that many cardiologists have not kept up with this kind of research. What is your response to why there seems to be a lack of cutting-edge information on the arginine therapy that's available among that of your profession?
How many drug reps do you think comes to our office selling L-arginine? Nobody does, because it is a generic product. So all we hear from our literature is lowering cholesterol, use nitroglycerin. That's what we've been sold. And as a medical profession, to be convinced and to say, all right, you know, nutritional supplements can also play a role, sometimes we feel it is demeaning to us. But at the same token, look at how many years it took for us cardiologists and internists and family practitioners to be convinced that cholesterol lowering is good for you. It took 25 years because it took that long for us to be convinced. most of us. Even now, there is reluctance in how aggressive we need to be. So it's not unexpected. It is not unusual when a product like L-arginine, which nobody promotes, it is there in the literature, but nobody is taking the step. Unless there is money to be made, nobody's going to promote it. And now there is people taking the first step to promoting a nutritional supplement that is going to be beneficial.
Now, I understand that your specialty, or one of the things that you have contributed greatly to the field of medicine, is in the specialization in certain types of stents. Could you tell us a little bit about that?
We do a lot of angioplasty. Last year alone, we did about 450 angioplasties in our practice. We do drug-eluting stents. We do bare
When
metal
you
stents.
started putting the patients on your study with the ProArgi Plus, what kinds of results did you anticipate, and what ended up happening after the 90 and 180 days that gave you such an astonishing report?
I knew what L-arginine will do. We knew it will lower the blood pressure. We knew what lower blood pressure means to our kidney function, to our heart function. So we knew what the product in high enough concentration can achieve. But some of the stuff that we noticed was remarkable. And in short time, not the time that we expected. Say, for example, if I were to give a patient medication for high blood pressure, we will lower the blood pressure, but the results of lowering the blood pressure would take years to see. But this product, on the other hand, we saw lowering the blood pressure through this medication, other side effects, beneficial side effects that were immediate. Within a month, we started seeing tremendous benefit, which was
One of the things we hear often is that people should be concerned if they're on Coumadin or Plavix about the fact that ProArgi Plus has a small amount of vitamin K. How do you respond to that?
Vitamin K is never an issue when you're anticoagulating patients. As long as they're taking a product on a consistent basis, then we can adjust the medication easily. And I always hear patients who are on Coumadin not to take any salad and green vegetables. And as a cardiologist, that is just opposite to what we are taught. We are told we need to eat vegetables and broccoli because that's good for you. So what we tell our patients, we don't tell them to avoid the product. We said moderation. You don't go eat a head of lettuce, but as long as you're introducing green vegetables on a daily amount, then we will adjust the Coumadin accordingly. Same thing with any product that contains vitamin K. As long as we know the amount of vitamin K you're receiving is constant, then adjusting Coumadin is going to be easy. It's not going
What
to be a big issue.
about pulmonary hypertension? Did you see any improvement in the study on that?
We have a large population of pulmonary hypertension patients, and that is one of those benefits of using ProArgi.
That's exciting because it sounds like a lot of people went from using oxygen almost 24/7 to not needing that. Is that something that surprised you?
If it is truly pulmonary hypertension and if we were to measure the pulmonary pressures pre and post treatment and they had significant improvement, then it was not surprising to see them no longer requiring oxygen.
Lastly, sometimes that people ask me, what impact does the dilation and the clearing of the capillaries and arteries have to do with renal failure or even other organ disease outside of the heart or cardiovascular disease? What kind of an observation do you think you can judge from your experience now over the last 6 months?
Think about it. Everything depends on blood flow. Blood flow governs whether you have a stroke or you don't have a stroke, whether you have normal liver function or not, whether you have normal kidney function or not. So as long as we improve blood flow, then all these organ systems will be healthier. So as we grow older, as the arteries become harder, they become less compliant. These are the reasons why kidney functions fail. If you look at a person who is 70 years old, their kidney function is half what it was when they were 30 years old. Why? It's because of cellular death contributed to a certain extent by lack of or inadequate blood flow. So if you're improving blood flow, then you're improving survival of the tissue.
Did you find that neuropathy was one of the first things that seemed to be an improvement among the people that were in the study?
not so much as a neuropathy in terms of symptoms of pain, but in terms of improving their circulation. Remember, part of the reason why the legs develop neuropathy or neuropathic symptoms is because of lack of circulation. Peripheral vascular disease is one of those things that is very prevalent in our population, especially in our diabetic population, and goes along with it comes neuropathy because of lack of circulation, which is contributing. It's not all of it, but it contributes. So if you're improving microvascular circulation, then you're going to improve symptoms of neuropathy.
Yes?
Yeah, the only thing Synergy provided for the study was the product itself. Everything else we did it on our own. In terms of all the testing we did, what we wanted to do with the patients in terms of 6-minute walk tests, the laboratory testing that we did, all the stress tests and the echocardiograms that we did, all that was done on our behalf, not on Synergy's behalf. Nobody compensated for it.
Well, it was interesting because the majority of patients were already my patients in the congestive heart failure clinic, and then there were other patients that were referred to me by Dr. Siva as the study started to unwind. And what I also saw was in a 90-day time period, my very sick patients, okay, did extremely well. And we had a cross section of different type of patients with congestive heart failure. We had patients that had pulmonary arterial hypertension. We had patients that had malignant hypertension. They were requiring multiple medications to be used. We had patients, diabetics with small vessel disease that had peripheral vascular compromise. We had a whole array of patients under the atherosclerotic or congestive or coronary artery disease, okay, umbrella. And across the board, we saw results for every type of patients and their own disease process.
Have you ever seen anything like those kinds of results from this kind of a single application of one product?
No. I have been doing, like I say, I've been doing critical care nursing, okay, for 22 years, and I have never been associated, okay, with one single product that has had such a profound effect health-wise, okay, for so many different diseases. Because at the end of the study, Dr. Siva and I had sat down and we started looking at the different patient population and who benefited the most, you might say. As you may know, diabetes, a very insidious disease. I think it's going to be one of the disease processes that's going to have a biggest burden on our healthcare system. That patient population and also the patient population with pulmonary arterial hypertension benefited extremely well. We had patients that we actually took down from a WHO class 4 down to a WHO class 2, okay, which is extremely interesting when you work with a disease process that gets progressively worse with time. We actually reverse that process. Now, in that light right there, it has now come to a point where if anyone that gets referred over to the clinic, okay, that has the new signs and symptoms of pulmonary arterial hypertension, whatever their etiology may be, we are going to make the recommendation that we introduced the ProArgi 9 Plus, okay, initially as the first line of treatment.
You know, Angelo, we know that you were one of the participants in the High Desert Heart Institute study that had 35 initial participants. Tell us a little bit about how you got involved in that study. In fact, maybe let's even go back a little bit and tell us a little bit about your health condition that led you to seek out the help of Dr. Siva and the High Desert Heart Institute.
I had a renal failure, congestive heart failure, and pacemaker failure concurrently, and it necessitated my being sent to the hospital. After I got out of the hospital, for the next 5 to 6 weeks, I was in the hospital about 2 to 3 days minimum every week as a result of congestive heart failure. It basically was the real primary reason, is that nothing was happening. I had been taking all the medications possible. I was medically managed to the maximum extent, and finally I gave up. Quite honestly, I'd had enough. I got weak. I was on oxygen 24 hours a day, 7 days a week. I couldn't walk 15 feet without stopping. I couldn't even open up a bottle of water. My wife used to have to open the bottles of water for me. I decided to take myself out of the hospital. I asked them to remove all the IVs, and they told me that if I went home I would die. And I said, just give me the papers I need and I'll go home, because if I'm going to die, that's where I want to be anyway. Coincidentally, that was on a Sunday, and I had a pre-scheduled appointment with the congestive heart failure clinic on Monday. I went there, and Dan Austin, who is the clinical director there, and Dr. Siva recommended that I go on a study of a product called ProArgi, which is a dietary supplement. Well, I was just a little bit set back that they'd been doing everything they could. I felt, you know, what are you going to do with a dietary supplement? And in all truthfulness, I didn't really think it was going to work. But so I did what they said, and I went on to ProArgi, and there were 35 people total. And in a few short weeks, I began to actually feel better. I wasn't sure at that time whether I was feeling better or I was thinking I was feeling better. But actually I was feeling better. By the end of 3 months, I felt really pretty good. By the end of the third month, I was doing things that I hadn't been able to do for years. My triglycerides were down. My cholesterol was down. Everything was back into the normal range. Oxygen, I no longer use oxygen. It was about 3 months afterwards that I stopped using it. I didn't need it. As far as kidneys, my kidneys are something else, went all the way back to normal. I just had the test here Tuesday, and my kidneys are at 0.9 for the creatinine, and supposedly that's very good because I think around 0.7 is supposed to be like a teenager. So my kidneys went back to normal, and I was expected to be on dialysis as a minimum and a kidney transplant. So they've gone back to normal. Asthma, I have asthma. You wouldn't know that I have it. I have no shortness of breath. I can walk further. I mean, it's unbelievable. I don't get any shortness of breath in walking. My brother died from congestive heart failure. My mother died from congestive heart failure. Many of my friends have died.
Tell us a little bit more about some of the other people you associated with in the study. How serious were these people who were involved in the study, and were they handpicked because of certain situations, or were they all pretty much in a similar situation as you were?
Well, they were handpicked, but they were handpicked on the basis of they picked the worst people. There were 33 that I know of out of the 35 that were what I'm going to refer to as, my term is nearly deads, okay, including me. And I got to meet the greater majority of them while we were there. And I could see that they were getting well in talking with them, because I actually spent about 4 to 5 hours at the clinic once or twice a week getting all these tests done. And we've had people who were at the clinic who had legs that they were told by their own doctor to have it amputated. They did not have it amputated because they didn't want to, but after taking this study, not for the leg but for the congestive heart failure, that leg has ended up looking great. It's good and doesn't require amputation. That's on one person. Another person was in there taking magnesium. They were there 3 times a week with getting IVs for magnesium because they couldn't get their magnesium level to the minimum required. They also had heart problems, but they were in there for this reason. The first thing they happened to notice was that the magnesium count was increasing. By the end of the 3 months, they were not using hardly any of the magnesium. The magnesium level had gotten back into the normal range, and the person was taking magnesium tablets as well as IV medication direct. And there's no magnesium in the product. That's the interesting thing.
So it obviously seems to be helping the absorption of the magnesium that people were getting otherwise. What was the attitude among the clinical participants as the weeks unfolded and they actually started feeling better and, like yourself, actually trying to grasp to a glimmer of hope that had not existed when you started the study?
Well, they were all really pleased. I mean, especially we had one gentleman that was there. He was taking nitroglycerin tablets, an average of about 16 per day for the angina, I think it's called. And at the end of the study, he was only taking 1. So and he's still on it. I've not had an opportunity to talk to him since, but you know, the angina pains went down substantially. I could just go on, but the attitude of the people was great. I mean, they were all feeling good. The interesting thing is at the end of 90 days, which was the length of the study, most of them went off of it. They kept 10 of us on. I happened to be one of the 10 who was one of the worst cases for an additional 90-day study with a reduced amount of the ProArgi. And the other people who were on it, after several weeks, had to come back to the doctor because they weren't feeling very well, and they noticed that they believed it was because they needed something else, and the doctor told them, you really need to get back on your ProArgi. So, but everybody felt good. It was great to go there and see the people being tested and feeling more positive about life. It was terrific. All were very happy. The results truly have been astonishing. I can only say, based on speaking with the people who were there, they all had unbelievable results.